Approved the additional funding of 405 million rand to go towards the purchase of critical healthcare equipment for the public hospital system in the hotspots of Gauteng, Western Cape and the Eastern Cape. This was in response to the expected surge in hospital admissions caused by COVID-19. As part of this budget allocation, 250 million as approved for the local production of 20,000 non-invasive ventilators in support of the National Ventilator Project, earmarked to be delivered by the end of August. The first batch of ventilators are ready to be handed over today. We cross live now to Charlotte Maxeke Hospital, where my colleague Diabo Sito is.
What we are going to do is unveil the so-called CPAP device. And CPAP is an acronym that stands for Continuous Positive Airway Pressure. And this is a very simple device that in fact has been developed in South Africa, which I think is a wonderful innovation. And in the setting of COVID, it offers us an alternative and an option to provide an additional intervention to patients who are no longer adequately sustained with just supplemental oxygen. So it is a device where oxygen no longer can offer adequate supportive care to a patient, where we can intervene. And in fact, the intervention with this device will often prevent patients from actually going on to formal invasive mechanical ventilation. Many of you may also be aware that when people are failing conventional supportive oxygen therapy, so-called high-flow oxygen devices have been utilized. And these are fairly expensive devices. And this particular device, in fact, in many people who have failed high-flow, in fact offers and confers in many instances a very, very positive effect, and once again may prevent the necessity to go on to invasive mechanical ventilation. So that is the background to this device. It is not a new device. In fact, many years ago, we were using so-called wall CPAP with great effect. But I think one of the issues that needs to be taken out here is it can be utilized to prevent the necessity for invasive mechanical ventilation in some patients. It's very simple to utilize, very simple to apply, and I think because of the simplicity of issues, it doesn't necessarily have to be utilized in a tertiary tier level academic hospital. It in fact can be used in lower tier hospitals very efficaciously. The training on a device like this literally can be done within minutes. It is very, very simple to utilize. And so it has the potential to save many lives. Beyond COVID, its use in fact can continue. It is not just an intervention for patients with COVID pneumonias. So it can be used for patients with cardiac failure who require additional support. It can be used for obstructive sleep apnea. It can be used for other forms of respiratory failure. And so we have a device which is not only very practicable, simple, and easy to apply. Another very important aspect of it is that it is relatively inexpensive. So put into perspective, a device like this might cost in the region of 50-fold less than a high-flow nasal oxygen device, and possibly as much as 200 or even 300-fold less than a formal invasive mechanical ventilator. So there are a lot of very, very useful elements in the context of this. Obviously, if patients fail this and require invasive mechanical ventilation, we certainly proceed. But it is a very useful issue that could save the lives, and does, of many patients. And I think another very important aspect before closing is that this has all been done within the South African context, which I think is a remarkable issue. And in a time where everyone is stretched and jobs are difficult, it is also allowed for job creation, which I think is another remarkable issue. And so I'd like to just personally thank the Solidarity Fund for driving this initiative, for involving many of the people who are here today in this initiative, and there are many people who need to be thanked. But at the end of the day, it's about a team effort, and the CEO and I were chatting about that earlier. So I think I would just like to thank everyone who's been involved in the whole context, who's really given up a lot of time and effort to make a difference in the lives of many, many people, and this device certainly will go a long way and has to making that difference. Thank you all very, very much, and thank you for the opportunity to share a few words with you.
Give it to me. Okay. Thank you very much. Thank you very much, Prof. May, for giving us the background of the machine. Professor May is one of the first clinicians who actually picked up that there is COVID-19, even before we had it in the news. That's how astute our clinicians here at Charlotte are. He was among the first because he's the president of critical care in the whole world. So he met with his colleagues and they started chatting about what is going on. And he's been in the hospital every day without fail since COVID started. So he knows all the patients who were admitted in our critical care in this hospital. We thank you and your team for the hard work that you are doing. Without much waste of time, I'm going to ask Ms. Gloria Sorube, who is the chairperson of the Solidarity Fund, to tell us why they decided to partner with us on this beautiful activity. Yes.
Thank you very much, colleagues. Thank you very much, CEO and Professor May and the MSc and the Head of Department, Professor Kele, and my CEO at the Solidarity Fund. I just want to say, CEO and MSc, it is quite a nice coincidence that we're handing over our first batch of ventilators at Charlotte Maxeke Hospital in August. She's always been a woman of the first, and even she still remains being the woman of the first long after she has passed on. We really appreciate that. It is quite significant. The important thing about this ventilator production, firstly, not being medical people, we were shocked to hear as a Solidarity Fund that all the ventilators we have here are coming from overseas. We do not have local production in South Africa. That actually scared us. It scared us for many reasons, because as now the whole world is queuing for the supply of the ventilators, South Africa was not going to be a priority there. Wherever we buy them from, the CEO told me some come from Germany and other countries. But we also have a problem that needs ventilators as well. And so that really worried us a lot. And so we were pleased when then government, through the National Department of Trade and Industry, decided to look into this as an experiment as to whether it can be done locally. And the Solidarity Fund, we didn't even think twice about it. We had to support that. And so the first support was to make sure that we fund the prototypes, to make sure that the research comes to a certain point where we can say we can actually do it. That was in June. That was in June sometime. And then what was also very interesting for us is that a partnership between the Solidarity Fund and government in that high-end form of, because South Africa has got the top scientists in the world, and there was no need for us not to use our own scientists to do our own scientific product. And even most interesting is that this concentration of scientists is sitting with a state-owned enterprise, SABC. That we also found very, very exciting, because sometimes we do forget that some of these entities have got pockets of excellence, and CSIR is one of those areas. And so the consortium that has made these ventilators is a consortium led by CSIR. It's very important that we do say so. The Solidarity Fund partners with CSIR, partners with a government to hand over a product to a government hospital. That is what we find very exciting. And that is a story to be told. And I think the one last piece, we were just worried, not sure anymore, but we did have this conversation with the CEO and the HOD as to ventilators post-COVID. Are they still important? It turns out it's one of those legacy projects. And you need ventilators for a whole lot of things, even more especially for small towns where people are far from hospitals. Because as Professor May says, this is an equipment easy to use. And so while people are driving 120 kilometers to a hospital verify and all that they need is oxygen, this product becomes very useful. And so with that, I want to say thank you very much, CEO. Thank you for accepting the product. Thank you, MEC, for saying yes. Thank you, HOD. We are much more excited to actually see that the product is actually here and it's now working. Thank you very much.
Thank you very much, Ms. Sorobe. Those are kind words, and we really appreciate the partnership. By the way, these pieces of equipment are not only going to be used at this hospital. We have 14 other hospitals that refer to us. We are live streaming it. They are very excited, the other hospitals, to receive this. And Prof. Mayor and the nursing department under Mrs. Chitereke have committed to train everybody on how these ventilators are going to work. Without much waste of time, I'm going to ask our acting MEC, Mama Bolo, thank you very much for coming to give us words of encouragement. Over to you, MEC. There's the...
Okay, thank you very much. I hope you can hear me. Can you hear me? Okay, thank you very much, CEO, May Gladys Bohoshi. And let me take the opportunity to acknowledge and appreciate the Solidarity Fund chairperson, Ms. Robe, the Solidarity Fund CEO. I hope I'll pronounce it correctly. Kita Noeli. Thank you very much. And of course, let me really take this opportunity from the very bottom of my heart to acknowledge a very important person. Can I call you President? President, Professor Mayor. And thank you very much for that very brief, good, excellent background and context to why we are here, and for the good work you're doing. Now, let me also just acknowledge our head of department, HOD Prof. Good morning to you, to all the management of Charlotte Maxeke and all the workers, everybody who's here, and of course the colleagues from the media, different media houses that are here. And I would like to say, Chair, Happy Women's Month, Malibongwe, and congratulations, and I must also thank you for the choice of the month and the venue. I think that's highly remarkable. Now, ladies and gentlemen, on behalf of our provincial government, I am deeply pleased and privileged to receive this donation by the Solidarity Fund of the non-invasive ventilators as a contribution to our response to the demands that the pandemic has placed on the South African healthcare system at this juncture. In the past few weeks, the department has been working tirelessly to ensure that our facilities across the province are well resourced with protective personal equipment, staff and other relevant needs required for an adequate response to the COVID-19 pandemic. The reality is that this pandemic has taken the global health fraternity by storm, and while we are all working towards understanding and adapting to the new normal, the pressure for innovation within the health sector has in all certainty been mounted. Now, the Charlotte Maxeke Johannesburg Academic Hospital has played a significant role in Gauteng's response to the COVID-19 pandemic since the very early days of virus transmission. We also
All right, and then we conclude there where those non-invasive ventilators have been handed over to the Charlotte Maxeke Hospital. The World Health Organization is about to brief the media in Geneva.